Alright, my name's Sean Verlindi. I'm a student nurse, and I'm going to show you how to put a catheter into a male and female patient. I'm going to pretend this patient behind me, which is a water bottle and some pillows, is my patient, and this is going to be my first time meeting him, and I'm going to have to catheterize him. Okay? So let me just cover him up quick. So first thing you want to do before you even go into the patient's room is you're going to want to check the doctor's orders, make sure you have the right patient, right procedure, and then you can get started. Okay? So we're going to walk into the patient's room, hand sanitizer, wash our hands. Hi Mr. Smith, my name's Sean Verlindi. I'm a student nurse, and today I'm going to be inserting your catheter. The reason for your catheter insertion is your bladder is just holding a lot of urine, and this is going to help empty your bladder. Do you have any questions for me? No? Okay, well I'm going to go gather some supplies, and I will be right back. Leaving the patient room, hand sanitize, okay? Always when you leave and when you come back. Supplies we're going to need: our catheter tray, catheter, sterile gloves, bottle of saline, hand sanitizer. So coming back into the patient's room, hand sanitizer. Alright, Mr. Smith, I am going to get started with my sterile field here and get my catheter stuff set up, and if you have any questions along the way, feel free to ask. So this is the part I want you to pay close attention to. This is going to be my sterile technique. I want you just to watch my hands, watch anything I do, and if you can tell me if I break sterility at all, great. Okay. Good. It's a small table, so it might be like a little overhang, but we're going to do the best we can with the space we got. Okay. Let's move this to the side. Good. Good. Now that we have our field set up, this area right here is going to be sterile, okay? So we can take this with our sterile forceps, start putting our stuff in the center. We're not going to be taking a urine specimen today, so we can just discard this, okay? Okay. Now I'm just going to put my forceps down for a sec on the edge of my sterile field, not in the contaminated 1 inch. Okay. And we're going to grab our catheter. We're going to expose, wish this one wasn't open to make it easier, but we're going to expose the tip of the catheter. We're going to pull it out using our forceps. We're going to place this in the middle of our sterile field, discarding the packaging. Okay. Put our forceps down again for a second. We're going to take our saline. We're going to dump out the first little bit, and we're going to put the rest in with some cotton balls. Okay. Now I'm just going to get this out of the way. Now that everything is set up and we are ready to catheterize the patient, we need to get the patient ready because we're going to have to put sterile gloves on. So, Mr. Smith, we're just going to pull the blanket down. I'm just going to pull the blanket down, and it's only going to be, you're only going to be exposed for a moment, okay? So, there we go. So now we need our sterile gloves. We're going to take our sterile gloves, and there's not a lot of room on this table, and if you ever do run into this problem, just take them and put them on the patient's bed. It's not going to be touching anything, so it'll work fine. So, open it up, discard the packaging, be left with this. Put them down. One more fold open. Sterile gloves. They're wrapped around like this. You can touch anything there. So we're going to take this, slip our hand in. Still sterile, right? Just touching the outside. See? Now we're going to get our other sterile glove, loop it around the bottom like this. Put our glove in there. Still sterile. See? I'm just looping it in. There. Sterile gloves. Sterile field. Patient's ready. So now we take this, get this away from the patient. Now, we need to get the patient ready to go. So we're going to take the first soaker pad. Now I want to show you how I'm holding this, okay? Just like this. So here's the sheet. I'm going to put a thumb on each side. And I'm just going to wrap it around like this. So here's the other side, just so you can see. Okay? That's what that looks like. That's going to go underneath of the patient. There. I'm going to take the blue one. This one's going to cover the genitalia. Same idea. Wrap it around like this. Take it over the patient's genitalia. Great. So now the patient's ready to go. He has some privacy. That's one thing I didn't mention. We're going to close the drapes. We're going to close the drapes for the patient. Make sure that he has privacy, okay? So let's continue. Now we need to check the catheter's integrity. We want to make sure that there's no problems with this. So we're going to discard the plastic and we're going to take our syringe full of normal saline. So most catheters tell you how much to insert. This one is a 3 cc. It's just a pediatric catheter, but same idea. So we're going to insert 3 liters of saline and we're going to check the bulb's integrity. So there, bulb's blown up, no problems, no leakage, great. So now we can just let go of the plunger and it's going to just deflate on its own. We're going to put that back in there for a second. Then we need to take our lubricant, open our lubricant, our catheter again, and we're just going to lubricate the catheter. Make it less painful for the patient and make it easier to slide in. Discard this. Back into the catheter tray. Now we're all set up. Now we just need to take our catheter tray, move it over to our patient, right underneath. Now we're going to perform peri-care on our patient so he's clean for the procedure, okay? So we're going to do male and female, okay? Once this hand touches the patient, it's contaminated. No more touching anything sterile, okay? So here we go. Okay, Mr. Smith, we're just going to get you cleaned up here. Once around, discard. Once around, discard. Last one, once around, discard. Okay? Female patient. Once down the middle, discard. Once down the side, discard. Once down the other side, discard. Okay, now we can take this cup. We don't need this anymore. Discard it. Also don't need the tweezers anymore. Discard them. Now we're going to take our lubricated catheter and we're going to start inserting. For women, it's about 7 to 10 centimeters. Men, it's about 17 to 22. There we go. We're going to insert until we see urine. Once urine starts draining, we're going to insert it just about another 2 centimeters. So there we go. Now we're going to inflate the balloon with our saline. Good. Now we can touch this. Pull that out. Discard. We're just going to pull this out, make sure it catches. Okay, catches fine. So now we're going to attach it to the connector. There, it's tongue to the connector, and we just hang the bag on the side. And that's how to insert a catheter.